name is Ashley Wright. I am the Stratford County Public Health Network Manager. I am joined here today with Police Chief Tim Macklin, owner of the Gathering Place in Somersworth, Dina Gagnon, City Councilor Don Austin, Associate Principal Lisa Mockridge, and School Board Chair Maggie Larson. I am the co-facilitator of the Hilltop Mental Health and Wellness Commission, and these folks are on that commission as well. It is a group that has been meeting for at least 8 months or so to discuss the challenges and existing resources in Somersworth around mental health and wellness. We are here today to discuss and really start that conversation with the community around mental health in Somersworth. We will be hosting a summit later this spring that we hope you will join us at to continue that conversation in the community around mental health, wellness, and recovery to build a more supportive Somersworth. So I will start this panel. Thank you all for being here today. What does a community that supports mental health and wellness look like? What are the existing resources? How does it look? How does it feel to be there? We'll start, whoever would like to go first.
Well, I think it's from previous experience with a child that is a survivor of suicide. Navigating through the process as a young person is very difficult. School is a great resource for help and finding new ways to or resources to help with that. I think it's a challenge for a lot of people, especially being new to a situation that maybe they hadn't had in their life before.
Awesome. I think to sort of piggyback on that too, from a school perspective, is being able to have those community resources that we can provide to students and parents. Sort of time bound and resource bound sometimes within schools, the things that we can provide. So to have those community connections and referral sources is really important to us.
Yeah.
I think it's important to talk about a community that has access to these services, and access not just in terms of location of where the services are, but in terms of how you access those services, like through your healthcare plan or other ways. I think a lot of people sometimes are limited in their access because they don't have healthcare coverage, or they have limited healthcare coverage with high deductibles or whatever. Yeah. And so I think we have to recognize that access is sort of a two-pronged approach, both in terms of where the services are delivered and how you access those.
Great.
Yeah. I think from a law enforcement perspective, I applaud the school's approach as to any mental wellness issues that may come up, and a lot of it can be handled in-house, as opposed to, this response and a taking of a student out and transporting, and the stigma and the privacy issues that develop. I think in the last few years that is fantastic, and I think more of that in the community, as well as, access to, it's kind of like an urgent care clinic. It would be like a walk-in clinic that would have zero stigma, and it's the same as going for a physical checkup, where those are more accessible to people and not ostracized as, oh my God, to go in that building.
Right.
It's an honest approach, I think.
I think definitely as a prior student, we didn't have a lot of law enforcement involved in the everyday aspect of school, but now we have an amazing resource officer that is here on a regular basis, that builds relationships with the students, that makes it more comfortable for them to turn to help, especially if they're advocating for themselves as a high school student or something like that.
Yeah.
But
Right.
what do
Maggie,
you think?
did you have things to add?
Right, I was just going to say, starting the conversation is such the critical step, is having a conversation, having that education piece, being aware on all fronts in our community, from our youngest children, for reducing trauma and having care, parent education, through our schools and into our community with adults and elderly population. The connection that happens through our conversation, and speaking about it is our first step. Actually being open and kind of continuing that dialogue in our community is vital.
Yeah, and that's really what we're here to do today. And I really commend you all for being here and joining this conversation, starting this conversation. We talked about, or you all talked about a handful of things. So access to services, and whether they are physically here or not, having the actual access, the ability to get into those services is critical. We talked about the schools and where the school and community relationship is so vital. And of course, the very unique perspective from law enforcement and being able to support the mental health of folks in this community. And Maggie alluded to it a little bit. You know, we so often focus on youth when we talk about mental health, and it is such a critical piece, right? We want to support our young people so that they can grow up to have a less stigmatizing world to live in, so that they can have access and build resources. But we also have folks that struggle in our community who are adults. Mm-hmm. What are some of the resources, or what does a community look like that supports adult mental health and wellness? What are some of those things in our community, whether they exist in Somersworth right now or whether it's a goal that we look forward to? What can we do to support, or what does a supportive community look like for adults with mental health issues?
Well, I think Chief Macklin raised an important point about having a place that is a lot like what we refer to now as a walk-in healthcare. If you have some sort of a minor injury, you can walk in and get your services and be done with it. I think that kind of access would be really important because there certainly is a stigma associated with mental health, whether that's a stigma imposed by society or whether it's a stigma we have internally. I think that anything we can do to remove that barrier certainly would be an asset. And I also want to say that it's important to recognize that this is a community concern, and schools have done a lot to address these concerns with students and their families. But there's a whole world out there outside of the school, outside of people who have children in schools that also have those kinds of issues. So we have to be cognizant of the fact that we have to address those needs as well. So I think something like a walk-in facility, something like maybe monthly mental health sessions that people can feel they can attend just to get information. Things like that would be helpful.
So just really building those information channels and those touch points that we talk about, so that people have the ability to connect with folks and looking at people's basic needs and looking at really what care can we provide to people, not only in the mental health realm, but in the basic needs realm, so that we can support them so that they feel supported and connected, and they're more willing and likely to connect with resources specific to mental health.
Right. We want to give them access before it's an emergency, before we have to call the police. Or I mean, and we dealt with a lot of that at the warming center. We were fortunate that we had the warming center here in Somersworth, and could give people access to care throughout the night and stuff like that. But it was really important to us to make relationships with those people, because a lot of them have mental health issues, and that's why they're in that predicament. And to be able to navigate that with the police and services was really important to us. And so trying to make those connections and make people feel comfortable before it becomes an issue, or before you have to call 911 because somebody's overdosed or right. And so to make it comfortable for people to come and speak and have conversations and give education would be amazing.
Yeah, and really specifically with that, the population that is experiencing homelessness.
Yeah,
we've talked so much about making those connections, communicating, and really being able to meet somebody where they are and provide access to those services, whether it's then and there or whenever they're ready, but creating those environments that really are supportive.
Because they're not going to outsource for something. They need it to come to them where they're comfortable, or to be someplace where they're comfortable.
Right, and Chief Macklin?
I think it's important, but the point you bring up, we often had contact with those individuals that aren't quite at the crisis yet, but it's more of less of an impactful type call that you know, whether it's some type of neighborhood thing or some type of welfare check, that you can tell that in whether it's 3 hours or 3 days, it's going to come to that critical point.
Yeah.
And there's almost zero options to try to mitigate that before it does. So I
Right.
think
Yeah.
that's an important goal to have.
Yeah.
Yeah. And we've talked about stigma quite a bit already, but really, what impact has stigma related to mental health had on you or your role, or that have you seen the impact in your community?
I mean, I could start by, there's an overwhelming expectation, I think, from the public where you may see, I'll start off by saying, I think there's a stereotype that only those that have suffering from mental wellness issues are those at a street corner or carrying 3 backpacks or whatever. And certainly in the mainstream society, there's a lot of it that doesn't come out to the public because they have a lot of resources, I think, in family support, friend support, versus those experiencing homelessness, substance use disorder, poverty, etc. And I mean, it's the stigma from the general public is that person's off their meds. We as police should be able to just take them to a magic place and get them on their meds, and then they'll be fine. And even when they're not an imminent threat to themselves or others, you know, it's a line that we always have to explain to people that, you know, we're trying to do the best we can for them. We really have no cause or desire to take them into custody for any particular reason until it gets to that critical point where we may have to, and that's frustrating point is not being able to stop them from getting there. So you know, and then I think a lot of the people that are experiencing the homelessness and the substance use disorder, not all, but I think there's a large number that have untreated mental wellness.
Yeah.
And then using crystal methamphetamine, which is out of control, not only in this city, but all over. And that's what they're medicating with. And so if you see them, when we see them, we get reports whether they're doing push-ups in the roadway, hugging street signs, dancing with trees, or just outbursts in the public, that, you know, it's the crystal meth and other type drugs that are causing that outward behavior, whereas if the mental wellness was treated, you know, maybe we wouldn't get to that point.
Right, and so often, and sorry Dina, so often we talk about people experiencing homelessness who also have a substance use disorder and untreated mental illness, but more so, those things compound each other and develop over time with people's experiences and situations and what resources they have access to. But to, I think, a point that you made early on, everyone in the community is somewhere on the continuum of mental wellness, mental illness, whether they're having a good day, a bad day, they have challenges or a diagnosis. And that access plays such a critical piece in what their outcomes are. And substance use disorder and mental illness so often are co-occurring disorders. They happen at the same time together. And access to treatment for one or the other doesn't solve their compounding issues.
It's hard because, I mean, people will, again, stigmas, you know, why druggies go away or whatever. You've got to understand, these people are self-medicating because that's their only option. They have things deep down that they struggle with every day. If you had to worry about where you were going to sleep, how you were going to eat, you know, medical issues, a lot of them have a lot of medical issues. They just don't understand. They're not doing drugs to have fun. It's not a party. It's a mental way for them to self-medicate. They are going through things that we can only imagine. And so coming from a parent that I felt like I was a good parent, my household is a good household. We have, you know, a roof over our head. We have everything on our needs, but I still had a child. I have several children with mental health issues. You know, I have OCD, ADD, those are all mental health issues.
Yeah.
I have depression, anxiety. I have a daughter that, you know, tried to commit suicide. And that's a good household.
Yeah, I think the community, I mean, the health of our community is so important to everyone. We're
Yeah.
not disconnected from,
Right.
you know, as much as sometimes you don't want to see things. I think Somersworth has laid a path of dealing with hard things and speaking the truth, whatever that is. And sometimes it's not easy to speak about.
No.
But it's necessary in order to see what the next step is.
And when my children were little, it was always a disability. They had a disability. You know, it's okay. They have a disability. We'll fix it with education. We'll fix it with the proper, you know, tools. But then as older teenagers, then we realized it was not just a disability. It was a mental illness. It was a physical illness. It was, you know, so a lot of times it's something that builds up, and that eventually you end up finding out that there's an issue bigger than you can solve by yourself.
Yeah, and I think that speaks to the necessity for this to be a community-wide approach to supporting mental health in our community. And so again, so often, right, the stigma or the pointing of fingers and the blame and shame goes into people not wanting to get help or not seeking help from other resources. And you know, it's not just a family at home problem, and it's not a police problem, and it's not a school problem. It's an everyone problem. And really looking to the community to come together and recognize that and support that and start that narrative and make those connections. Lisa, from the school's perspective, of course, so often things get put on you here to solve them in-house or to go home and solve them, right? What does stigma done within the school system, or what has the school system done to sort of combat stigma and have these conversations? I've seen a lot of support for students come out of the school and really, right, making those connections with outside community entities to bridge that gap.
Well, I think one of the big things for schools is for us to be as proactive as we can with students. I think a lot of times we end up having to be reactive when things, you know, when we start to see an issue with students, or we start to figure out that there's mental health issues because a student has an attendance issue, or we've seen a decline in their grades, or there are behavior issues that we're seeing that we didn't see with that student before. And so, you know, many times we're reactive in that situation. And I think one of the things that we've tried to do is be proactive, getting information out there to students and trying to take that stigma away, that it's okay to ask for help. You know, we have a psychology club here that started this year, and that was initiated by some of our students. And it really came out of a student who took an AP psychology course and got really interested in how do we help our students here, and with exactly that, how do we lessen the stigma of mental health, and how do we provide resources and make it okay to talk about it and have a safe space for students to go to. You know, I mean, we have our guidance department, and we, you know, teachers have been great resources, but it needs to be broader than that. You know, any possible resource that we can have available to students, and getting them to talk about it and know that it's okay to talk about it. And also, we did mental health first aid training with some of our staff this year, and you know, it's helping us and our students recognize the signs in themselves, but also in their friends, so that when they see something, they know how to react, and they know how to get that friend to the resources that they need.
Totally.
And Dina, thank you so much for sharing your experiences within your family. Thinking about where we are as a community and the experiences that we've all had within this community, thinking of where we are and where we want to be in relation to mental health and substance use prevention and overall wellness around mental health, how can we move from where we are to build an even more supportive community in Somersworth around these topics?
I think, you know, we talk about having a summit and talking about having conversations with people, but in some ways I feel like we need to go to them also. Maybe, set something up in our elderly community that makes it available for them to participate so they don't feel left out. A lot of people are struggling in that community because they're isolated from family, or they don't have family, or they don't have a network of people that they can count on to help with different things that make it difficult for them. And also to try and make it part of our education. Make wellness a part of our education. Teach kids how to be respectful and advocate for one another and sympathize with one another's problems and issues. And I don't think there's enough of that. I mean, I know our teachers do amazing things and are asked to do amazing things, but maybe just broadening it a little bit.
Finding more opportunities
Right.
to embed that overall wellness, that social support and connectedness
Yep.
within the school system.
Right.
And I
Yep.
know that the school does so much work
They
to
do,
really
like-
do that. And I think that
Yep.
there's also opportunity outside of the school with our
Mhm.
youth to build that community connectedness. And
Yep.
you talked about creating spaces for other populations who might not be able to come to our
Right.
summit later
Yeah.
this spring, who might not be able to, for transportation or other reasons, might not feel comfortable joining our conversation. We talked, in length about people experiencing homelessness might not feel like they're
Right.
welcome in that space. And how do we create communities within our communities that really find ways to support everyone? Chief Macklin.
I think I would bring up 3 points where within the public, and one of my goals is the ACER team, the Adverse Child Experience Response Team. And we are in the process of trying to seek a solid future funding through various organizations. We ran it for a year, and it's, traumatic events that a child may have been either involved in or witnessed, and it could be anything from witnessing a drug overdose, fatal or non-fatal, to domestic violence, to, any type of traumatic event. And we connect them with services, and we often found that there's underlying mental wellness issues. So I think it's a very good early warning program, and I think that's important to have in the city, and we're working on that. Another goal is an absolute concentration on de-escalation and crisis intervention teams, which I recently had somebody certified as a de-escalation instructor, and we're having 2 more.
That's great.
And within the department, I mean, it works. It requires patience,
Right.
it requires training, and it doesn't work in all cases, but it is absolutely a goal of my administration is to implement that on a more formal basis. Our CIT team is going to increase by 3 to 4 members, and we can have more of a formal approach to different calls. And then internally, 21st Century Policing Presidential Report is Officer Wellness and Safety. So we have started a CISM team. Everything has an acronym, but
Yes.
a crisis, critical incident support type team, where we have already somebody certified, where it's an anonymous program internally that an officer can go speak to somebody from the CISM team or our chaplain. They can be either or both, and that it greatly addresses that in the presidential report of whether it's the horrific things that we see or hear every day, year after year, and you just let it build. And they've kind of opened it up. It's okay, like somebody said earlier, to ask for help, to ask to speak to somebody, even a veteran 30-year officer,
Right.
or especially the younger officers, because they are, they are more, I think, adept at not being used to seeing that type of stuff. And if it's a normalcy to speak to somebody to help you through it, in
Right.
a mental wellness approach, kind of like going to get your blood work done or getting a vaccine or any other
Right.
thing. I mean, that's it's prevention.
Right.
And,
Right.
and to have that internally is So those three things, I mean, the goals of my administration, and I think
Yeah.
it couldn't just be the police department, it could be a private business, another
Right.
government organization.
Yep.
To have those same priorities
Right,
is
to
to
start.
take big steps.
Right, to
So-
start looking internally, how are we supporting ourselves, and whether it's our family or our students or our business or organization, our employees and their families.
Right.
How are we looking internally at ourselves and then externally at our community and the impact that we have within the community, and really building that capacity to make those steps forward.
Yeah, I always think about the airplane conversation, okay, when the mask drops, you do you first.
Right.
And then take care of, so as individuals, and as police officers and teachers and stuff like that, it's take your mask first, and then that way you can help, others.
Right.
So.
Yeah, I think
Yeah.
that we're only if we're not taking care of ourselves and kind of having that reflection on and way to support ourselves, how much can we give? So
Right.
hearing about our police officers, the people that take care of our community, because our safety is
Right.
paramount. For our staff and our teachers and the people that help our community run, to be able to be well and have those resources is I'm deeply grateful for.
Yep.
As an individual, as a parent, for families to have those resources that they may know from neighbors helping neighbor and having that community connect. It doesn't always have to be a formalized effort. It can be someone received a training, someone knows something, but
Yep.
in life, when we connect with others and we have that outreach, it really can be not only life saving, but really develop a sense of support and well-being in your life. I mean, everyone experiences that without each other.
Yeah.
We really don't have.
Sure.
Yeah, and
From a city governance perspective, I think it's important to make this a priority at a city council, at a city manager level. And I don't think you do that just by saying, well, we're going to make it a priority, right? I think that comes over time as the community as a whole insists that it becomes a priority. We've spent the last decade improving our infrastructure because the community demanded it. We've done other things as a priority. We devoted resources to them because the community wanted us to do that kind of stuff. So I think this is a similar kind of thing when you look at it from a citywide governance perspective. We have an opportunity as a city council to take an issue like this and determine that, yes, this is a priority for Somersworth, and we don't have an unlimited amount of resources, but we could prioritize it in such a way that once the community identifies what it's looking for in terms of resources and facilities and access, maybe the city has an opportunity there to create that infrastructure for mental health and awareness that we talk about is needed at an individual level, and certainly that's where it has to start. People have to indicate that there truly is a demand for that kind of thing. And once that happens, I think at the city level, we can then take that and determine how we can support those kinds of things.
Yeah, and I think we've already started to really take that step, and that's the purpose, right, of the summit, is to bring everybody together and bring folks in to hear what the perspectives are, hear what the needs are from people in the community, rather than us telling the community what's needed. So really looking forward to that. Any final thoughts, Lisa?
And I was just going to add, I think it's really important to be able to bring the resources to people that need them. I think many times we give people resources and then ask them to access them, and that's a barrier. I know many times we're guilty of it here at schools. We provide resources, but whenever possible, if we can bring the resources directly either into the schools or into the families, we've had great success with that through rapid response. When a student's in crisis, it's best if we could bring the professionals to the student versus having to send the student out to the professionals. So in whatever, the partnership looks like, just being able to bring the resources directly to our students.
Yes, and I think that is such a great point to end on, that rapid response line that is active now. It's a 10-digit phone number that anybody can call if they're in crisis, and if the person on the line will talk with you and identify where you are in your crisis, and if it's necessary, we'll send out a response team. And I've heard feedback from the schools, of course, already that's been a positive. in our community, and it is available to anybody and everybody that would like to access that phone number. So thank you all so much for being here today. I really appreciate you taking the time to start this conversation and really encourage those of you who would like to join this conversation to join us at the summit later this spring. We'll share more details on here as well as on our website and social medias across the table from this Mental Health and Wellness Commission that has been joining. So thank you all again for being here today. I appreciate your time, your input, and your dedication to this work and really bringing mental health and wellness to the forefront of the efforts in this community. So thank you all so much and have a wonderful day.